The Gauteng Health Department is warning the public to be cautious of cholera this Easter weekend. The warning coincides with religious events such as baptisms that are taking place at such a time. At least 11 cases of cholera have been reported in the province and one person has died as a result. For more on this now, we're joined virtually from here in Johannesburg by the Gauteng Health MEC, Nomantu-Nkomo Ralehoko. MEC, thank you so much for your time this evening. Let's start with the numbers. I do understand the 4 new cases were picked up just last week, and that has brought our figure to 11, including 1 suspected death as a result of cholera. Can you confirm those numbers for us, and that indeed that your department believes that those 4 new cases do stem from baptism ceremony that took place in the eNCA and Klip rivers?
Yes, indeed, we can confirm that those cases do come from baptism that has happened in some of our rivers in the province. Hence, we are worried that because the Easter weekend, we do go to church, all of us, and there are those ceremonies that our religious leaders are going to do. And we are indicating to them that they must make sure that at least they use an area where it's running water. The water is not just standing in one place, because if it's that type of a water, it will end up creating problems like we've seen in these incidents. It's quite shocking that it can happen, but now indeed it has happened in those 4 cases because they were checked and people were indicating to us that they were in church and they go through that baptismal that reverends or pastors did.
Now, just a few weeks ago, I know your department was very quick just to ask for calm and for residents of Gauteng not to panic. You even dismissed some reports on social media and saying that there's a crisis with Johannesburg's drinking water. Now, that was a few weeks ago. Can you paint the picture for us on how you've been able to track the cholera?
In fact,
how you've been able to track it since you sent out that message to say there's no need to panic, the drinking water is still fine. How has that process been going in terms of making sure people don't panic, but at the same time, in situations like this, are still quite wary of the water that they come into contact with?
We have been having educational programs to our communities. We immediately activated our command center, where we've been able to have those sessions with the communities and telling them that they must not panic, but they were telling them the do's and don'ts in terms of this disease that is cholera. And we were warning them that if they drink water, they must ensure that at least there's a little bit of teaspoon of salt that is in that water, and you boil your water again. So we were trying to give them those activities that you will expect in an area where you are not using water, that that it's not safe. But again, our water is still safe in our areas. That's what we were telling the communities, because remember, it was just somebody that was naughty that said, we have said that the water is not safe in our province. So that one we have not said.
What's the reaction been, though, from those community members that where you've rolled out this information and communication program? Because it must be quite frustrating, because you are dealing with communities who don't have the best access to clean running water from taps, and sometimes they just have no choice but to access that water. Is this a multifaceted approach that's needed, that you need the departments of water and sanitation involved as well? Because surely this is a battle that the health department can't fight on its own.
You are right. In fact, we have been working very closely even with the municipalities, because some of the municipalities have been helping us in becoming part of our campaign of ensuring that people do use safe water in their specific areas. And I agree again with you that we need now to broaden the scope and involve the Department of Water Affairs. We have not started that, but we are going to do that now, because clearly this is serious, as we have seen that now the cases have moved to 11. Yeah.
I do understand, however, that lab results of samples taken from these rivers, specifically eNCA and Klip River, which are the 2 focus areas for you, samples taken from there, the lab results have come back as negative. What are the scientists telling you, though?
They've checked the water and the results will come up negative, but they said again, let's not stop conscientizing people so that, because we don't know when this will happen now. So hence that educational program will not stop about it. I'm sure you have seen, if you're following us even on our groups, your social media and Twitter, that handle that we've been talking about this, because we don't just want to let it lie, because it can happen. We want to make sure that we prevent, and then we don't wait that we have these cases in a number of issues that can happen in the province. So we are going to still intensify the campaign. We will not stop. We'll link it up with other programs that we're doing in the province of localizing our health and speak about that. We have been visiting even hostels and informal settlements, telling them that, especially those that are selling food, that there are areas where they sell food must be clean. They must have clean water. They must not keep the water closer to the areas, like if you wash and then you just throw water in close by. You must use the drainage system. That's what we've been encouraging them to do. So we will not stop, because you can't just stop. In fact, what the message again that we've been saying as the department is that we want to prevent these diseases. Hence now we're even called the Department of Health and Wellness. We want to maintain our wellness programs in the communities so that we don't just react on issues, but we prevent them, all these diseases that we know that it's possible that they can happen if we're not clearing and cleaning our environment.
What have you heard in reaction from religious leaders? Because, you know, sometimes many people are probably more leaning towards trusting the word of their religious leaders in their communities than there are from some official from the health department that's come to have a meeting with them at their community hall or their church hall. Would it be key to get these religious leaders on board in terms of them explaining to people why we can't do this baptism in this river like we always do this time around? We need to do it in this hall where we can ensure the water that we're using is safe.
Good thing is that I am deployed by the Premier to chair the religious subcommittee that convenes all the faith-based organizations in the province. So it has not been a difficult message to send to them that now there is cholera in our province. Let's be cautious, all of us. Let's make sure that we work. And when we do our work, especially when we do baptism events that will take people to water, we are telling them that at least they must practice safety measures. I know that because I'm an Anglican, when we're being baptized, one go to the river, they just put you a little bit of water in your forehead. So I think that now we have to tell them to change the style of work so that they don't take people deep into the river. If they are doing that, you must not stay in that water. It must just be a quick thing that you will not open your mouth when you do it. So they were positive, in fact, because I've been working with them even during COVID-19, because I was chairing that subcommittee even at that time. So the relationship is quite good. So we have not been having any hostile environment from them.
Just a couple of questions before I let you go, just in terms of information. What are the symptoms that people should be looking out for?
In fact, we will have diarrhea. In fact, that's what you will have first. So once we can see that you have diarrhea, you must know that at least you are not well. Just contact to the nearest clinic. That's what we have been telling them. Because sometimes you can go to the toilet once or twice, but once now it becomes excessive, you must know that there's something wrong with you. So we want to tell them that they must not take things for granted, because anything is possible now. But clean water is the one that they must make sure that they use. It must be the running water again if we are taking it from the river. It must not be the water that is standing in one place, but you must boil that water. And I think it's an easy thing to do, because that's a cheaper way. It's not an expensive one to do. And don't forget sometimes to put of salt in your water, but boiling it's more proper and more safe.
Now, MEC, you can't be everywhere this weekend monitoring our religious traditions that are taking place. If people who are watching this right now know of a grouping that's going to ignore this warning and they're going ahead with baptism specifically connected to the eNCA or the Klip River, the Klip Rivers that really are connected to some really populated areas here in Johannesburg, what can they do if they want to try and contact the department to let them know that they're worried that people are putting themselves at risk?
They will definitely find us. They can even communicate with the team in our website. We are there. And some of my religious leaders, they know my numbers. They can phone directly to me or send a WhatsApp message, but we'll tell them that they must avoid these rivers where I've indicated earlier on that where the water is not running, they must avoid that place. It's a dangerous place, definitely for the human beings, and they must make sure that they don't dip them too much in the water so that they end up drinking that water. Because you drink the water when you open your mouth, definitely if you are you are baptized. So there must be a bit creative, do what the other traditional churches are doing, like your Anglican church, which is my church. I know if that session is going to be done, baptizing children, they will be definitely put some water and that little cross at the forehead. So I think that we must start creating new things now as the religious leaders. That's what I want to plead to them, because sometimes it's dangerous when you want to do the old style of baptizing them, the children or the elders, because they are affected at the end with these diseases. And at least now they know that Kliprifir and Jaskei are the rivers that are more critical for them not to use, because we've seen the incidents of people that have been able to have cholera when they were baptized there.
Okay, we're going to leave it there. Thank you so much for all that information. That's Gauteng Health MEC, Nomantu-Nkomo Ralehoko. We thank her for her time.